Health Matters with Karen Key.
Well, there's an organisation called the Hudson Initiative, which was started by a mother whose 4-month-old baby boy died after being born with an abnormally structured heart. Now, she's fighting to make other parents aware of CND, or Congenital Heart Defect. And to tell us more about this condition, I'm joined now by Dr Liesl Zuhlke. She's a paediatrician and president of the Paediatric Cardiac Society of South Africa. Dr Zuhlke, good evening. Welcome to the show.
Good evening. Thank you very much for having me.
So rather a sad way to start off this interview, but what exactly is CND, or Congenital Heart Defect?
Yes, so it's CHD.
Oh, sorry, CHD. Why did I say end? I've gone completely mad.
No,
CHD, sorry.
No problem at all. And it essentially is, in fact, the most common birth defect that we are able to encounter, and it implies that there's something wrong with the structure of the heart. So it implies a defect or an abnormality in the structure of the heart, or the blood vessels that either lead into the heart or lead out from the heart. So in short, the heart should have 4 chambers and 2 major vessels leading in and out of the heart. And if there are any abnormalities in that, that's called a congenital heart defect.
Now, is this something that can be picked up on an ultrasound during pregnancy at all?
Yes, it can. So firstly, just to let people know just how common this is, the incidence of congenital heart defects is thought to be about 1 in 100. So it's actually very common.
That's very common.
Very common indeed. And as I mentioned, it is the number 1 birth defect in the world. But it can be picked up on an antenatal ultrasound. So those of us who have had children and remember having the ultrasound during the pregnancy will know that one of the most important things that the ultrasonographer looks at is the structure of the heart. So as I mentioned, it's got 4 chambers, and that's one of the particular things that they look at from very early on to see whether the heart has got all 4 chambers. However, there are slightly more intricate problems that they will also look for, but we also have to bear in mind that in South Africa at the moment, antenatal ultrasound is not universal. So it happens in clinics, it happens in private obstetric or gynecological visits, but this doesn't happen in every single pregnancy. So many pregnancies come to term having not had an antenatal ultrasound.
Now, the need, because I think the Hudson Initiative, which is what was started after this baby died, they are pushing for the need for testing before babies leave the hospital. So they're sort of trying to catch what wasn't caught during during the pregnancy, through the ultrasound at that point, and now hoping once the baby's born that they then should be screened. But is that not too late, and what can be done then?
Yes. So, it's a very important question, what could still be done if we pick up a defect after baby has been born. And in fact, there's a great deal that can be done. So, of all of these defects, virtually all of them are amenable to surgery. For the more serious defects, of course, we're not able to entirely correct the heart. But the progress that has happened in pediatric cardiac surgery over the last 50 to 60 years implies that probably about 96% of children can survive into adulthood, and even those ones can have virtually a normal lifespan. It's quite interesting to note that in America these days, more children or more adults that were born with congenital heart disease are alive and living a very normal adult life than are being born with congenital heart disease. So there's a great deal that can be done. For some children, they don't need significant surgery. Other children will, but if you don't make that diagnosis early, obviously then it's not as amenable to treatment if we pick it up later.
If a child had this condition and was the mother and the child were discharged from hospital, would there be any indication that there was a problem, or could something develop possibly after you get home a couple of days later?
Yes, well, that is the big problem, is that some of these conditions can actually develop over the next couple of days. So immediately after you're born, you essentially still have what we call a fetal circulation. So the way the heart and the blood circulates during the fetal life takes a little while, sometimes even up to a few weeks, to actually change into the more adult circulation. Certain things close, certain things open, and there's a little bit of a change over those first couple of days. And that change means that you may not pick up the fact that there's what we call critical congenital heart disease. and those only get manifest after 3, 5, or 10 days. Those are the ones where they're actually life-threatening, and it's extremely important to pick those up before baby is discharged from hospital, because you still have that period then that you can do surgery so that you don't lose that baby.
How difficult is it then to do these tests before the baby is discharged? Is it a case of money to buy equipment? What is the problem?
What is the problem? Yes. So firstly, it's not an easy thing to diagnose. So every baby should be checked out before they discharge from a hospital. And every clinic, every hospital where babies are born do that. But as I mentioned, it's sometimes easy to miss certain signs and symptoms in an early baby. So, for example, you know that babies soon after birth have a sort of bluish discoloration of their fingers and toes. That is quite normal. However, when that continues or you have blue lips or tongues, that is difficult. And that implies that there's a problem. And sometimes those things are missed. So what's very important is a thorough and a comprehensive examination by a doctor or a nurse practitioner that knows what they're doing. And then what the Hudson Initiative is talking about, and what is very big news in America and the UK at the moment, is screening using pulse oximetry. So pulse oximetry basically means that you measure the amount of oxygen that is going to the hands and the feet. And you measure that with what's called a pulse oximeter. Many people may know it, the little thing that goes on your finger and gives you your heart rate and tells you how much oxygen there is in your bloodstream. In children, in neonates, so that's early babies, you can't just put it on your finger. You have to put it across their hand or across their feet. And if you can measure how much oxygen is in their bloodstream and how much oxygen is going either to hand or foot, so the difference between the two, you're able to get a sense that there could be a problem. And we've seen in big studies in other parts of the world that this may be a very reliable way of picking up those critical congenital heart defects that you may have missed otherwise.
Is this something that a parent can insist on before the child leaves the hospital if it hasn't been done during pregnancy?
So this is very new in this country, and at the moment our infrastructure in the entire country doesn't really support pulse oximetry as a mandatory test. So I'm talking here about the fact that probably 85% of babies born in this country is not born within private hospital. They're often born in clinics or in units that are not supported by a doctor, but more likely by a nurse or a midwife. And they don't have all the equipment required. Not only that, but if you pick up a case where you think there may be a problem, you now also have to refer that patient into a pediatric cardiologist so that you can make a definitive diagnosis. And again, that definitive diagnosis has to go to a tertiary center. So it's not as simple as just a one tool. There is that whole infrastructure that has to be amenable to be able to support a screening program. However, that doesn't imply that this is not something that can be done or can be encouraged or can be asked for. So certainly parents whose babies are being born in a private hospital or a hospital where they know the equipment is there, they can certainly ask for it. And it's a very quick and easy process. And also to make sure that whoever discharges their baby, before whichever clinic they're at, that the baby has a comprehensive examination before they get discharged.
Is this something where if you have one child that has this, that you're more likely to have another child with the same condition?
It's interesting that you ask that. So there are two sort of answers. The first one is that although congenital heart defects affect 1 in 100 babies, we do know that some of the defects have a genetic link. So, for example, people may know about Down syndrome, and children with Down syndrome have more likely to have a congenital heart defect. So in those groups of children, of course, the defect is more prevalent. However, for the rest of the children, it's just a 1 in 100. You don't know what the cause of it is. And in those children, it's best to screen subsequent pregnancies. And if you, the child, who had a congenital heart defect and now having your own child, the chances that your child could have a congenital heart defect is twice that, so 2 in 100. So you should insist upon antenatal screening and maybe even speaking to a geneticist before pregnancy to understand the increased risk.
Now, in the past, though, before we were aware of this condition to the extent we are now, do you think unfortunately, a lot of deaths of babies was possibly put down to sudden infant death syndrome? Because people didn't know what it was?
I think that's absolutely the case, and I feel quite sad to say that I think that's probably still happening. In fact, I'm sure that that's still happening. As the Paediatric Cardiac Society of South Africa, we're well aware of all the patients with congenital heart disease that come to our attention. And we have some idea of how many patients we should be seeing per year with specific defects. Because this is a worldwide phenomenon, it doesn't differ that much from one country to the other. And we know that we do not see the amount of critical congenital heart disease that we're supposed to be seeing. And so it's very clear to us, and it's always been a major concern for our society and all our members, that most likely we are losing patients that are either not being recognized as having a congenital heart defect or are being misdiagnosed as maybe having a cot death or having pneumonia or having sepsis, and actually the problem was a congenital defect all along.
So just to finish off now, parents, I don't want them panicking now. New parents or women who are pregnant, don't panic. If you've had an ultrasound while you've been pregnant, they will be able to in most cases, pick something up. If there's any problems, they should look out for when the baby's born. As you said, the blue fingers, and that's fine in the first day or so. But after that, we should be concerned and mention this to a doctor or a nurse.
Absolutely. So I think the major symptoms in an infant, so in a small baby, is the fact that the baby's not gaining weight well, a baby who breathes quite fast. So babies tend not to look as if they've been running or sweating. So they should, breathe easily. They should even breathe easily when they're drinking. So babies who are sweaty, who are breathing fast, who seem to tire a lot with feeds, and who are not gaining weight, those are the kind of concerning symptoms. And in an older child, again, children who tire a lot, sleep a lot, get out of breath with play, those are the kind of symptoms. There are pediatric cardiologists. We have about 25 of them in the country, in all the major centers. And if there are any concerns, you're very welcome to contact any of us. We have a website. We have a information portal for parents, either with children with congenital heart disease or would like to know more about congenital heart disease. There are lots of fantastic parent advocacy groups, such as the Hudson Initiative, that are trying to increase awareness. So we're not trying to make parents panic, but the most important thing is actually to increase awareness so parents can ask their doctors about congenital heart defects and check that their children have been examined properly to make sure that that's not a case.
Would you like to just give us that website or the portal you mentioned?
Yes, so the website is www.pcssa.org, and the website is, the portal is called www.africa.congenital.org, and that is an information portal specifically for parents.
Right. Well, there's lots of information, as you said. Don't panic. Rather just go and just keep an eye out. And if you are concerned, rather go. I mean, I always say it's a bit rather safe than sorry. So go, and if you're a little bit worried, go and take your baby to the paediatrician. Let them check it out. If there is a problem, they'll tell you. If there's not, no harm done.
Absolutely.
Dr. Zuhlke, thank you so much for your time and for joining us on the show this evening.
It's a pleasure, and I just would like to thank all the parents, such as Hudson's mom, and for all the increased activity that's been happening so that we can try and bring this to people's attention.
Thank you very much indeed to all of them and to you too for your time. Thank you. Good night to you.
Pleasure. Bye-bye.
Bye-bye. Dr. Liesl Zuhlke is a paediatrician and president of the Paediatric Cardiac Society of South Africa. As she said, there's a couple of things you can have a look at. It's www.tcssa.org or www.africa.congenital.org. And if you'd like to look at the Hudson Initiative's website, that's hudsoninitiative.org.